Okay, very good. Thank you again for being here. We really are in a time when we depend upon people being informed and interested. And so it's your coming here to become informed or to help us ask good questions and learn more, and your willingness to be engaged. We want to keep that going and really appreciate it. Tonight we're going to be doing a Medicaid budget panel discussion, and this is in anticipation of what might happen with the one big beautiful bill, which pains me to say, act. As it stands now, as you all know, that bill has been approved by Congress and is waiting for Senate approval, which, unless it's approved unchanged, will eventually involve some reconciliation. I say that because I want to encourage you not to think that this is a done deal, and that we should continue to talk to our representatives and any other way that you can think of to be involved before some of this becomes reality. According to the March 2025 analysis of the Congressional Budget Office, 93% of the cuts will have to come from Medicaid. That's $880 billion in cuts overall over 10 years. And if 93% of those come from Medicaid, that's a fairly substantial number and should have big downstream impacts, which is what we're going to explore this evening. These cuts would decimate our state budget and state economy, cause significant harm to the health and economic security of 1.1 million Coloradans that are enrolled in Medicaid, and could lead to closures of hospitals and clinics that are part of this already frayed social safety net. Particularly in rural and underserved areas, those effects would be most prominent. So I'd like to start by introducing the people who have been kind enough to share their experience and expertise with us this evening. I know that expertise has become a nasty word in politics these days, but we're lucky to have some tonight, and hopefully you're among the group of people who still think that's worthwhile. My name is Denny Weber. I'm a retired infectious disease doctor. I've had a little experience in dealing with some of this on a more personal level, but mostly we're going to be hearing from these people up here. We have, first of all, immediately to my left, Katie Blickendorfer. She is the Chief Clinical Officer at Diversus Health, which means that she interacts both with patient and patient care, as well as the financial ramifications that might occur with some of these changes. Immediately to her left is Dr. Terry Weber. She is a retired family practice doctor. She's been practicing in Colorado Springs, or was for over 30 years. To her left is Scott Brassfield, still practicing family medicine since the 90s. So they have both seen what might happen to patients and to patient care. And then finally, on the far left, we have Leanne Webster. Leanne is kind enough to come representing SEIU Local 105 for healthcare workers. And certainly they have their own take on this. So I think we should get a nice kickoff to the evening by getting some answers from some of these experts. So with that having said, I'd like to get started by asking a few questions and sort of see where that takes us. First of all, let's start with Dr. Scott Brassfield. And Scott, what we'd like to ask is, how has the Medicaid expansion that occurred under the other administration, I guess during Obamacare, how has that helped your patients, if it has? And then finally, for families that lose access to Medicaid, what might be some examples of the consequences to them and particularly to children?
Well, am I audible? Yes. Okay, sounds good. The expansion led to a large number of people being covered who previously weren't covered. I think it went from like 100% of the federal poverty level up to 135%. So you added those people at the expense of the federal government, or at least most states did. Some states got their backs up and wouldn't take that money. The extra patients are productive. What if I've got lots of patients who have diabetes. How do you work? How do you manage your diabetes? And if you don't manage your diabetes, how do you work? So it has an impact on your family's income, your ability to support your kids. Plenty of risk factors are controlled by primary care. And so primary care, much of the expansion, I think, went to primary care, illness prevention, improved health, and improved productivity. Now, a story I'll tell you is the other side of the importance of Medicaid. You can have a disaster. I had a patient in 2021, right in the middle of the pandemic. On a Friday, she's Spanish speaking. She's actually a green card holder from Spain. So finally, she got someone who spoke Spanish, got qualified for Medicaid. On Monday, with abdominal pain, she went to the ER and was diagnosed with cancer. I'm not going to say exactly what kind of cancer for privacy reasons, but got diagnosed with cancer, got appropriately operated on, was ready to be discharged a week later, cured. Unfortunately, the surgical repair fell apart, necessitating another round of surgery, 2 more surgeries. That also was complicated, requiring 2 more surgeries. So we're talking about 15 months or so during which she was ill and probably spent 40% of that time in the hospital, and maybe a third of that was in the ICU. So the bills would have been absolutely catastrophic due to the fact that she had Medicaid by 3 days. Of course, she might have gotten it in the hospital, but having Medicaid, I'm unable to answer the question of how much cost was she spared because she actually never saw a bill. So you have both things. You have improved health, improved productivity with primary care conditions like diabetes and high blood pressure and heart disease, heart failure, various different things. And at the same time, you also have protection from an absolute catastrophe that can happen, and you get stuck with the bill, and they do try to collect.
Thank you. Let's take a little different perspective now. We're going to ask Ms. Webster if or how you might personally be affected if Medicaid cuts or Medicaid access was unavailable, and then also assuming that selective Medicaid home health care services are cut, what would happen to your clients?
Well, when people don't have Medicaid or coverage in health care, then they lose those care workers. It creates a ripple effect. So agencies will automatically cut staff. That's the first thing they're gonna do, is cut the amount of staff. So nursing homes, there are, after I looked, according to some, there are 16 nursing facilities that require Medicaid, are dependent upon Medicaid to continue. Those nursing homes would shut down. Here in the Springs alone, that's 16 nursing homes. Where does somebody who is elderly go, who has no family, who's 80, 90 years old? You're kicking them out on the street. So now we have more homeless seniors in our community. If you have family to take you in, then you're looking at the ripple effects of stress on the body. We've done numerous studies on how caregivers, family caregivers, taking care of the financial and the physical and emotional trauma affects their health, their future. Maybe they have good insurance, but that insurance is then going to have to pay more because now they've developed ulcers from all the stress they've had to gone through. What's the other thing? Workers will leave. Okay. So we didn't give my little background, But my name is Leanne Webster, and I have been a certified nurse's assistant for over 32 years. I've worked in home care for over 14 across agencies. I've done private clients, I've done medicated facilities, and I just completed my master's in healthcare administration to change the system. Thank you. The point is, my body don't hang anymore. Okay, I can't do those 12-hour shifts and not walk out worse than some of my patients are able to walk. We will leave the industry. We'll go down to Amazon and watch little buckets and totes and be happy as clams with real good insurance. I did that for a while when I moved to Washington, but I have a calling. I get called back. It is in my nature. We cannot wait for people to feel the calling. Right now, in the state of Colorado, we need 30,000 more in order to get ready for the baby boomers that will need that care. So unless you're willing to up things, bring incentives of how we bring people into the healthcare industry, we can't be cutting. It is not time for cuts. It is time to, if you want to look at Medicaid and see if we can't do a little better, maybe provide a little more alternatives. Maybe some get into what is it? Massage therapy or other things that Medicaid doesn't offer that normal insurances do to avoid surgeries, to avoid those higher costs on the roads. That's what we do in healthcare administration, is we look at risks. What are the risks of cutting this? It's a ripple effect. Like you were saying about the diabetic medicine. So you're driving, you're driving down I-25, someone no longer has Medicaid, they don't test their sugar, they don't get their insulin. They crash into somebody. And whose fault is that? It's Medicaid's fault because they couldn't get their stuff. I could go on. I'll stop. It is a passion.
Okay, thank you. And I might say that it's, in addition to Medicaid's, it's a fault of the representatives who voted for this bill. So let's keep them right before us when we are thinking about that responsibility. Okay, now moving to Dr. Terry Weber, I want to ask you about something to do with children and births. 1 in 3 children in Colorado, 36% of our births are covered by Medicaid. How have you seen Medicaid help women and children when you were practicing?
Okay. That says I'm Alethea Ware, and I am her understudy. She's a nurse practitioner in private practice, and she is a fabulous human being as well as a great practitioner. I have practiced side by side with her. She continues to take a lot of Medicaid patients. I've been retired so long. So I'm going to kind of change that question. I'm going to answer Scott's because that's more of what I am. And what I noticed when the ACA went into effect was I was ordering colonoscopies a lot more. People were suddenly coming in for their preventative care. I was ordering mammograms. October was mammogram month or something, and I had patients who knew that's when they could get their cut rate mammogram, and that's when they wanted it to be ordered. So a lot of that changed. People suddenly were getting preventative care. And one of those statistics that might address that is that people who do not have insurance, their risk of dying of all causes, doesn't matter if they're diabetic or, you know, a strongman, increases by 25% if you don't have insurance. So the other thing that I had experienced in practice was Medicaid has a program where families, is this better? No? Yeah?
There you go.
Families, better? Families of people with severe disabilities, autism, developmental delays, people that can't function on their own, their families can be certified as a CNA and get paid for taking care of them. And it's like, 15, 20 bucks an hour. And Medicaid decides how much time your family has to devote to your care and pays you based on that. And so here you're strong, able-bodied mom, but your child has a peg tube, is fed liquids through their stomach, and is very slightly responsive, wheelchair bound. Is there a school that's going to take that child? Probably not. If they do, they will have to have a para assigned to that kid the entire day. So Medicaid, or the powers that be, pay that mom to take care of that child so that we aren't burdened with that in the schools, calling the mom, something's happened, the mom has to come, break away from her work day. So that program alone saves us millions of dollars, because where would that child be if the family couldn't take care of them? Back there in that nursing home that might be getting shut down. So the whole effect of where these people are going to be taken care of, I guess the question becomes, do they just want them to die? I recently just talked with an elderly man who has congestive heart failure, and severe congestive heart failure, you walk a line. If you eat a second potato chip, you could end up in the emergency room short of breath. So his cardiologist wanted him to have a stress test. And he had Medicare. He thought it was all great and good. He had Medicaid as his backup. He's a veteran. And he went to schedule it, and they said, oh, your copay will be $900. And he said, well, where's my Medicaid? They said, oh, you got kicked off of Medicaid. And he goes, nobody told me. How did that happen? Oh, you got a letter. He goes, no, this guy did not get a letter saying he was kicked off of Medicaid. So he's back down there trying to get recertified so that he can get this stress test. And by the way, they wouldn't even schedule it until he paid $500 cash, let alone try to get the rest of it. So he's getting his VA benefits in line so that he will be able to have a backup to his backup. And his question to us was, I just hope I die before they kill me.
I hope neither happens. Okay, Katie Blickendorfer. If Colorado were to drop their expansion population, by that I assume it's the Medicaid expansion that we're talking about, the estimate is that 230,000 additional people would become uninsured, which would be about a 50% increase in the rate of uninsured patients that you're being asked to care for. What would happen? How would you feel that?
Yeah, just for context, Diversus Health is a comprehensive behavioral health provider in our community. So we provide outpatient counseling, psychiatry, addiction services, as well as 24/7 crisis services. So you call 988, it gets routed to us to respond either in the community or have people come walk into our drop-in center for crisis. And we've experienced some of this already with the public health unwind. About 55 approximately % of our clients are Medicaid. That is dropped from about 70% a couple years ago. The public health unwind led to a lot of people losing their Medicaid, and now we're gonna see an even further drop. So as a comprehensive provider, we have a no right to refuse, and that's great for the community. Anybody can access any care with us, and we can't turn them away regardless of their ability to pay, their type of insurance, et cetera. And our Medicaid dollars have been used to offset the costs of providing care to people who can't pay. so that we still maintain 24/7 crisis services for anybody in our community, as well as access to quick behavioral health care. And so it's estimated, the Colorado Health Institute did a research study that every dollar of Medicaid that goes to behavioral health saves $4 in costs of criminal justice, homelessness, and other high-costing emergency room visits, et cetera. So it's so important to keep that funded. Diversus Health, with the changes that have happened and the state changing models and the decrease in Medicaid, we're operating at a negative budget right now. That's not sustainable in the long term. And you know, some of these services no one else does, that if we can't fix the payment model system in the state and federal government, then those services are at risk of going away. And they're often the ones that are serving our most vulnerable community members.
Thank you. So I'm hearing that I haven't heard a good thing yet that would be associated with any of this. I guess if you're very wealthy, the potential for your taxes going down because of the services being denied might be seen as a benefit. But otherwise, these are significant problems. We have a little time. I thought maybe, if it's okay with you, we might open the questions to the audience so that you can ask this first group of panelists. Now, there's a chance that some of your questions may come up and be more appropriately handled by some of our second group, and in which case we'll try to do both. But please, if you have questions, I'm going to put this mic on the stand. Just ask you to come up to the mic and ask your question of our panelists, either as a group or if there's a specific person that you'd like to ask, please do. There's plenty of time for that, so please feel free to do that. The other thing that I would say to you is that in the event you have a specific question and we do run out of time at some point, our panelists have said that they'll still be around a little afterwards to help speak with you in the event that that's helpful as well. Okay, so I'll put this up here, and please let us know what concerns you might have or what questions you might have. Everything's completely clear.
It's a bad thing. Cuts are bad.
I'll always ask. I'm running for Congress for Congressional District 5, and so if you guys have any policies that you think would help fix Medicaid, make sure that everybody has good health care. I mean, I'm for universal health care, but if there's any policies that intersect on the state level, county level, city level, can you share what you think would keep people healthier and safely in homes and nursing homes, whatever, but making sure they're healthy and safe?
I'll share one. I don't think it fixes our Medicaid issue, but I think there's a gap in the way our current system is structured. It de-incentivizes people from getting viable employment because then they lose their benefits. People who are on SSDI or SSI that might be able to work part-time have to be very careful so they don't lose their benefits that are giving them the ability to work, to previous points made. So I think there's opportunity to help kind of people transition back into being able to have private health care through a better model of kind of a transition plan as opposed to just cutting people off.
That makes a lot of sense, especially if they want to have work requirements.
On work requirements, I've seen figures that say that 92% of the Medicaid population either works full-time or part-time, most of them full-time. That's the biggest group out of this 92%. And among the remaining 30% or so, many of them have very serious reasons, such as that they're caretakers for people who are disabled, they are themselves disabled, and therefore aren't good candidates to work. So the work requirement is going to apply to very few people and probably require a very big bureaucracy that is going to be a humongous challenge and just slow things down, create chaos, create anxiety for people. that are afraid that they're not going to meet whatever requirement that particular evaluator sets in terms of work. So to me, there's no real upside to it. It's unlikely that they're going to get more money out of it than they're going to spend on federal workers.
I have a 4-word answer: single payer health system.
Absolutely. Medicaid for all.
And I'll just add one more thing. Some of the payouts that home care workers are not equal to what Medicaid is paying to the agencies. So we really need to take a look at where we are splitting that money.
I work in nursing homes, and CNAs do the hardest work, and they do not get treated at the level or necessarily have the staffing levels that they need to do a really good job. So, yeah. Thanks so much for your answers, you guys.
I just have one more
Oh, yeah.
thing related to Medicaid. I think there's opportunity for us to, we have a very reactive healthcare system. So we wait for people to be suicidal and need crisis services. If we could get ahead of that and treat people on the front end, the state and the federal government will save money. But with a reactive system, we're going to continue to have the highest healthcare costs.
Thank you so much.
My name is Alice Cole. I'm a retired nurse midwife. I am very interested in healthcare and the effects, but I have been elected by someone else to come up here and ask you to put all these wonderful statistics in some kind of order that we can use them as talking points when speaking with representatives and senators in order to make our points more clearly, because you've packed a lot into what each of you are saying.
I have a question from the Zoom, guys. It's me, mostly Katie. It is from Sandra Collins on the Zoom call. I've read that Colorado is ranked 45 out of 50 states for adult mental health care in 2023. Access remains a challenge for both youth and adults in need. Will these cuts change access to mental health care?
100% they will change access to mental health care. Because people won't have the financial means to access the health care without growing costs. And providers like us, Diversus Health, that accept people who are under and uninsured, won't have the staff to be able to provide the services. We will be not immune to making cuts based on the current trajectory we're on.
Thank you. I'd just like to add one observation that has struck me in the past. What you're explaining is the way our healthcare system works now. And the analogy that I could best come up with from my own experience is, well, yes, there's a problem with hunger, but what we advise you to do is just go to the grocery store and tell them you're hungry, and they have to give you food. That's the way we have people access healthcare now. Come to the emergency room and get your healthcare. This is not a system or a plan that results in people being taken care of. And if we accept that people deserve health care, which apparently we do since we require it to be given to them free, we probably ought to pay for it.
This is really a bit more of an observation. My name is Lois Page, and I'm a part-time educator. I've been in education for a long time. But I think one of the things that's often missed in our discussion, and I think this is really necessary to address this with our representatives, is we keep thinking of Medicaid as a cost. But in truth, there are benefits to society when people are healthy, they're able to work, they're able to add to the economy in very positive ways. And every time these senators and congresspeople talk about people who are on Medicaid, it's just to make them feel like they are less than. And that is not true. They are people who want to contribute to society, and when they do, we all benefit. So I would like us to start changing the way we talk about things. We need to start using different terminology. It's just like when we talk about Social Security. It is not, a handout. It is my money. I paid into it, And we need to keep thinking that way with respect to Medicaid as well as Medicare. So thank you very much for being here tonight.
I just want to reiterate about the framing around cost and how kind of disgusting that is, because when it comes to giving free money to the oligarchs or killing children, foreign children, no cost is too high. We don't talk about cost when it comes to those things. But when it comes to saving American lives, that's when we talk about cost. We got to pinch pennies when it comes to saving human lives. But yeah, we need to change the framing there.
Hello, my name is Michelle Tweed. Okay. I had a question regarding Medicaid. So, 2023, my mom was diagnosed with cancer, and the two systems were not communicating with one another at the Medicaid office. So it delayed her episode of care. Further in 2024, there was still a disconnect, so we had to wait for her episode of care for her to be seen because of their systems were not communicating, and I think that's an issue. So long story short, she passed away, waiting for all of this to take place. So how do we improve that for everybody's episodes of care going on in the future?
I'm sorry for your loss. And the system probably didn't help, may have even killed her. And this is where I wish Alethea were here, because she does do a lot of Medicaid, and there are a lot of connectors trying to keep people on Medicaid and keep them going forward with their care. And she would know more about that. And there is a program, and I will dig it out for you if somebody needs it now. She has cards in her office of how you can get back onto Medicaid, because they randomly just kick you off. You have to, and with this new system, you're going to have to show up every 6 months instead of every 12 months to get recertified for Medicaid. So there goes more bureaucracy and more expense. More people aren't going to have any idea how to do this.
Pardon, what if she had everything turned in?
I can't speak to it, but I'm just sorry that Alethea is not here, because
No, I understand.
she would give you a big hug too.
There was a study of the 12 richest countries in terms of healthcare quality, and you can guess who was number 12. That was us. Who was number 1 in cost? We were spending twice what all the other countries were doing. I think it gets back to what was just pointed out. We need single payer. One of the major areas where we were really bad was in administrative confusion and chaos, and just the complexity of the whole thing. So another point to our nurse midwife, one of the areas where we're absolutely awful is maternal care. We have 22 deaths per 100,000 live births. The average for this group of 12 countries was 3.5. So we've got 22. And some states, it's skyrocketed. Guess what? Texas, for example. And in Texas, the maternal death rate went up about 57% when they passed their absolute anti-abortion under virtually all circumstances, unless you're doing CPR on the mother or something. You know, it's really, in just 2 years' time, the maternal death rate skyrocketed.
And to piggyback on what Scott says, 33% of our births are dependent upon Medicaid. If those women don't have the option of getting prenatal care, what's going to happen to that rate? We know prenatal care helps decrease low birth rate and fetal mortality.
Okay.
Evening. Thank you for being here. And I could use a little bit of clarification. I've had private insurance for all my life. I'm now retired, and whereas my understanding is that Medicaid was considered to be secondary insurer, now Medicare is my first, and my private insurance is on top of that. In truth, isn't everybody on Medicaid once their private insurance tops out?
So by
That-
tops out, do you mean reaches your lifetime benefit?
Yes.
That will probably be answered better by the next panelists.
Good enough, then put that question in abeyance. Thank you.
We have some insurance specialists who will know the answer to that with much more authority. Yes, sir.
So earlier, it was touched on a little bit, some of the ripple effects that Medicaid cuts are going to have on our communities. To give a little background for me, my little brother is on the autism spectrum and will never be able to be fully independent. My family relies on respite providers and in-home caregivers in order to function in what we would consider kind of normal family and community life. We've had periods of time where 6, 8 months even, where they were not able to get respite care or an in-home care provider due to his significant and individual needs. And that resulted in, my father remarried and his wife had to quit her job to take care of my brother, which meant she was less active in the community and from an economic perspective, spending less money in the community as well. So anybody who wants to can take this up, but given your professions and your perspectives, what are some of the ripple effects you can see in the community just outside of the direct impacts of these Medicaid cuts?
I think one of those is caregiver burnout. That's a lot to put on a family, and to not have a break. And respite is already underfunded. ABA services for people on the autism spectrum is underfunded. So I think that is a huge impact, is then families burn out, and then we look to, do some of these individuals need to be in institutions, and then there's not beds anywhere. And so I think it's a downward impact of sometimes people that end up in the criminal justice system because they burn out of their family, they're in the community more, and then potentially get into legal trouble. And then the costs are even higher there.
I have a question for you. Where are the institutions?
I don't know where those are either. I think to the point earlier about the Medicaid nursing homes, those aren't just for our older adult population anymore. It is high behavioral health, substance use, young people that have nowhere else to go other than beyond the streets if they weren't in a nursing home, and their mental health needs qualify them to be in a nursing home. So I think in order to get into an institution in the state of Colorado, you have to commit a crime pretty much, because all of them are forensic beds at this point.
Can I add something to that? To your question,
Please go to the mic.
Sorry, my name is Kelly Salling, and my niece runs care homes on the Western Slope for disabled adults. And she provides very loving and enriching home environments. And if, none of her people could work. So it's going to impose more administrative burdens on her with every 6 month prove that you can't work requirement. But if her business is completely decimated, that's just, she supports her family on this business. And I'm sure she's not the only business out there that could potentially go under. So there's that kind of economic impact.
So thank you all for those questions. Just as a sort of parenthetical note, when Arkansas experimented with this sort of policy of demonstrating employment before you can get care or coverage, they discovered that a large number of people just could not figure out how to navigate the system, which, by the way, as you point out, is not easy now. So if it gets any harder, you can imagine what we'll be looking at. But the result was a lot of people lost care even though they did not have loss of eligibility even under the new rules. They just simply couldn't prove it. So if that's what you want, then that's the policy that they're proposing and that our representative, Mr. Crank, voted for. So I'm going to suggest now we take a short break, and we're going to come back with our second group of panelists. We'll be ready to entertain more questions with their presentations as well. And again, thank you for your involvement and engagement. That makes our evening much more productive. Thank you again.
Thank you.
So for our next group of experts, we are fortunate to have several people with experience on the financial and insurance side of this question. First, we have Liz Rosenbaum. Liz is at Be Well Health and is an ACA health insurance broker specialist. I'm going to keep their introduction sort of brief, but please feel free to say more about what you bring to this if I'm not hitting the nut on the head. We also have Liz McPherson, which is to her left. And let me try to get the right credentials here for her so that we don't do her justice. Well, rather than search around, Liz, I may have to let you explain. And then we have Representative Lorena Garcia. She is here to talk about, well, actually sits on a very important committee, Finance Committee in the State House, and can talk to us about what some of the ramifications of these cuts might be from that standpoint. So again, thanks to them for being here. And I think we'll open with the first question going to Liz, which is, what impacts to accessing health insurance are you currently seeing? And what impacts do you expect to see if this bill does in fact pass the Senate more or less unchanged?
Sure, thanks. Hey everybody, I'm Liz Rosenbaum. I live in the Fountain Valley area. I've run for office for a state representative seat, and it's the reason I got into health insurance is because our community was poisoned, and after 5 water poisonings, our health is impacted. And in 2018, the National Institute of Health and Sciences did a Zoom meeting. I was like, why does this keep happening to us? And they're like, you're easy to poison. Not enough people are on health insurance. You don't have a hospital and hardly any doctors. And still, to this day, 9 years later, south of Platte, we don't have a hospital, but way up north there are 9. UC Health just built a new pathetic facility, but they also cut out all Anthem plans for individuals and families, but kept Anthem corporate. So outside of open enrollment, I am a fanatic to get more access to health insurance, health care, expanding things. A couple of things have passed with me being in this area is Senator Tony Exum passed a bill where your medical debt does not show up in your credit report. That's good for us here. We also have one that just passed this last year was when you find out you're pregnant, it's a special enrollment period and you have 60 days like other things. And since then, I've gained 6 brand new clients because they had a birthday. So there is a lot of space and movement that we can do locally. And I know like literally shit has hit the fan, but there are still things that we can do to protect ourselves. So those are the kinds of things that I'll be presenting. So when you get kicked off of Medicaid, you have 60 days. There's a couple of things that are happening right now is the COVID extension is over, which was great. Under the Biden administration, everything just was a freeze. Because most of us understand that situational poverty can turn into generational poverty real fast. So if you're not worried about food and you're on SNAP, you can pay other payments. Same with Medicaid. Some of your email that you have is getting greedy. And like in Gmail, it only allows so much storage space. So you're not getting the emails that you should be getting. All right? So the whole I didn't know because nobody told me, you're correct. So we have to add an extra layer of something else for us to pay attention to, which is exhausting. So when you make too much for Medicaid, or now that extension has ended, you can move over into Connect for Health. And this is a benefit in Colorado. People who are saying, I wish I had Medicaid, Medicare for all. We are so close to having that in Colorado. It is income-based. So my young people that I have under the age of 26 who live at home with mom and dad, not being claimed on insurance or claimed on their taxes anymore, can now get a great insurance plan for themselves for sometimes $1. Kaiser or Anthem, all of these different ACA, Affordable Care Act plans, where you're guaranteed certain things, right? Now in our county, certain plans are better than others compared to like Denver County. It just depends on what's available, right? So I really got into Connect for Health. So I do their training, their onboarding every year, so then I can learn the latest state laws that have changed, how I can be a better advocate for my clients, and within Connect for Health, there are opportunities that other people may not have through Medicaid. So there are ways to get health care if you have any one of these documentation as being an immigrant here. Also, families with young kids, your kids probably get CHP plus and you don't realize it. Okay? If you want to, there's Representative, Lorena Garcia. She can probably talk about Omni Salute and Colorado Connect. There's like, it's like winning the lottery where you could just be an immigrant here and get health care where you wouldn't qualify in Medicaid because you do have to be here for 2 years in certain immigration status to get Medicaid. Okay, go ahead, next slide. There are about 409 brokers in Colorado. I was the only one from the southern end of Colorado Springs all the way down to Pueblo. That's about 200,000 population. So there aren't a lot of us. I would say more than half are dedicated like me. I will help anybody navigate any type of insurance, AC 65 and under. With Connect for Health, you can also, I can team up with what is called an assister, and they assist you with the government programs, making all the dots connect. It's pretty incredible. And I've been at this for 7 or 8 years, and every year I learn something new, or I get to participate in legislation. You can see by the numbers that it is significantly increasing. So we're going to be okay in Colorado a little bit longer than some of other states. So if you're removed from Medicaid, you have 60 days. That's it. If it's 60 plus 1, I wish I could help you. When COVID was happening, there was an extended open enrollment till August 1st. And the director of Connect for Health was going to our conferences, and he was like, you know what? The big fear of everything is going to crash if we have a longer and open enrollment did not happen. You know what happened? People got healthier. My young people under the age of 40, I'm like, hey, what do you want your health insurance to do for you? And they're like, man, I want some mental health. I've got plans where it's no charge. What we're going to lose with this big, stupid bill is all of the extra protections. So my young people that are 21 years old, they can get extra savings besides their tax credit. So a tax credit is, let's say you're 21 years old, your health insurance is $250 a month. When you get to be 64, it's like $890. That's the other Liz. She'll talk to you about that. So my young person is 21, makes about $21,000 a year. Their tax credit is pretty much the entire payment of their policy plan, their premium that month. They pay $1. Then they get the extra savings of, instead of a $5,000 deductible, they get a $100 deductible. So they're not going into financial debt. We have a couple of saving graces here in Colorado. So I help people from, hey, my husband has all of these health conditions, I don't know what to do, and I connect with someone who's an assister, and I'm like, what state programs are available? Then I can do, maybe the family is, like I do all ACA plans, and how do I get paid? I get paid a commission. It's anywhere from $15 to $18 a person per month. It's not a lot of money in the grand scheme of things. And I help my clients all year. You got a big medical bill? I better hear from you. Because if it gets to be November, I'm like, hey, how'd your year go? Oh yeah, I had a huge surgery. I'm like, you gotta let me know. You overpaid. Now you have to file all this stuff, and this is how much your major medical stuff is. Because 3 years ago, I almost died. Getting health insurance should not put you into financial debt, and the equation is about 9.8% of your income, which I still think is stupid. That's too much. That is way too much. But that's kind of a stop, like that's using Connect for Health is a way to bridge that gap. Okay, so if you have friends being kicked off Medicaid, go to Connect for Health. There's like 500 of us who would just love to help you get the care that you need.
Excellent, thank you. So that was Liz number 1. Now we have Liz number 2. There'll be a test on this afterwards. Medicare health insurance agent.
Yes.
What more should we say about your experience before I ask this question?
So I've been in the Medicare world for a little over 20 years. I started out at United Healthcare managing their sales team. And when an operations role opened up, my boss, who must have been dropped on his head as a small child, took a chance and hired me to be the director of Medicare operations for the state of Colorado. And I did that for an additional 10 years. 7 years ago, I got a wild hair and decided to leave the corporate world and started the Medicare Resource Center of Colorado Springs. We're located next door to Social Security on East Pikes Peak Avenue. We're insurance brokers that do nothing but specialize in Medicare plans. So there's never a cost to use our services. There's never an obligation to enroll. But what I see every day now are people absolutely panicking about their health care. You know, you've worked all these years. I'm going to be 61 in August. I'm just a few years away from Medicare. And I pay over $1,000 a month for my health insurance. And I see my Medicare clients that pay $185 a month for their Medicare. But what I really see the impact is Medicare and Social Security overlap. So there is no such thing as a Medicare office, like you go into the Social Security office. Starting on November 12th of last year, you can no longer walk into Social Security without an appointment. And thanks to some of the ridiculous DOGE cuts, when I spoke to my neighbors at Social Security the other day, they said they've lost 9 full-time employees since January. They can't backfill those people. 11,000 people every day turn 65 in America and qualify for Medicare. And our government has decided that they should do all of that online. You should just pull out your smartphone or get your laptop out and figure it out on your own. About half of people on Medicare that are entitled to extra help, maybe paying for their prescription drug coverage. Medicaid can come in and be a backup to Medicare. Those people, 50% of those people don't even know they qualify for these benefits. And I get absolutely passionate about it. But the anxiety and the fear that I see every day in the faces of my clients, because we don't know what next year's going to bring. I know right now the insurance companies are in the planning phases. So the the managed care plans, we'll start to see what those are going to look like come the fall. But it's so important that we let our congresspeople know. So I brought a bunch of these. They are not partisan. They just say, save my Medicare and Social Security. They're pre-addressed to Congressman Crank's office. They do take a full-size stamp, so they won't take a postcard stamp. His office is 1.5 miles from mine. We're going to become great friends, he and I. He doesn't know it yet. But I figure if he gets tired of seeing enough of my red postcards, maybe he'll consider making a change. So I encourage everybody to take some. I'll be happy to order more. But Medicare and Medicaid together, you know, I talk to people every day that are just a few dollars over that income limit. And that $185 that comes out of their Social Security check, that might be the difference between them being able to pay for their prescription and not being able to pay for their prescription. And with the cuts to Medicaid, between the funding cuts and the staffing cuts, people are just left hanging. It's absolutely draconian what's happening to people. So we're here to help, we're here to answer questions, and we're here to be really, really loud until they hear us in Washington. Because I tell my clients, this is personal for me, and it's going to impact my business and my personal life. So, you know, they've got to get through me if they're going to try to make changes to Medicare. Thank you.
And just to point out, we've been talking a ton about Medicaid. The costs that will occur because of the need for more savings will also have a trickle-down effect, from my understanding, so that Medicare will have something like, what, $500 billion in over 10 years cut from that plan. And we don't know what that would look like, but obviously if you take that much money out of it, something's got to give somewhere. So.
And the way it gives somewhere is through ACA plans. So the reason ACA plans are so expensive, especially to working families, is because these large corporations are like, yeah, I really want $30,000 for this service. Medicare negotiates a price. That corporation still wants all that money. So they charge, if you've noticed, and you go in, you're like, hey, what's a cash price for an MRI? Or if you have your broker, I'm like, hey, you need all this other stuff, let it go to insurance, let them charge that $1,500 because you will need surgery, or don't let it go to your deductible and offer a cash price for $300. So.
And I'd like to dispel a myth about immigrants and illegals, as they like to call them, getting access to Medicare. That is 100% false. You have to be a U.S. citizen or a permanent legal resident who has lived in the United States for at least 5 years to qualify for Medicare benefits. So this nonsense that I hear on television about people from other countries coming in and stealing our Medicare. Of course, I don't know whose brilliant idea it was to name Medicare and Medicaid. It's easy to confuse the two. If you're the easy answer is that Medicare is a federal program and Medicaid is a state program. But for a lot of my clients, they mesh together. And it can help people for everything from offsetting the cost of their prescription drugs to paying their co-pays to paying putting that $185 a month back in their Social Security check. It will be absolutely devastating to our seniors if they cut that, or if they start making the levels to qualify for Medicaid, more unattainable. 135% of the poverty level. That's just ridiculous. That you literally have to be destitute to get additional assistance in our country.
And the question that's on this slide actually comes directly to what you were just talking about, which is, according to the Healthcare Financial Management Association, more than 1.3 million Americans who are dually eligible for Medicare and Medicaid would lose the Part B cost-sharing assistance they receive through Medicaid, potentially leading to reduced access to primary care and hospital outpatient services. Can you explain to us who is dually eligible and then a little bit about the financial impacts of the loss of dual eligibility, which I think you just did a little bit.
So being called a dual eligible means that you have Medicare and Medicaid. So, but here's where it gets weird, is when you're 64 years old you're on Medicaid. When you turn 65, they say that you're kicked off of Medicaid. Actually, you go into a different program called the Medicare Savings Program. So there's 4 different levels depending on your income. Everything from, like I said, getting assistance with your prescription drugs to all the way up to paying for that $185 that most people have to pay for their Part B portion of their Medicare. If that gets stripped away, we're going to have people that literally are going to be making those difficult decisions as to whether or not they can even afford to have Medicare Part B. So Medicare Part A is free for us when we've worked 10 years or 40 quarters. Part B, which is the doctor's portion of the insurance, for most Americans costs $185 a month. And that typically comes out of their Social Security check. So if all of a sudden you're living on $1,200 a month and now you have to give up another $185 to pay for your Part B, I foresee a place where people just say, forget it, I just can't have that. And it makes no sense because it's not like they're not going to get sick and need access to care. It's just going to cost the rest of us more because we're cheaping out on something else. I mean, the fact that insulin that has been around for over, 100 years was up till 2 years ago was putting my clients in the donut hole is absolutely ridiculous. The assistance with prescription drugs, now they've changed how that is administered. President Biden did make some changes to it. It's a little bit of a double-edged sword. I jokingly say it's job security for people like me so that you need a translator to understand it. But, Lyndon Johnson signed Medicare into law in July of 1965 and said, don't change anything till I get back. And I think it's time that we start, every time I hear somebody from Congress talking about covering glasses and dental on Medicare, did you know that original Medicare, your A and B from the federal government, does not pay for a physical? How silly is that? We know that getting people a physical every year is going to lower drug costs. It's going to lower care costs. And original Medicare doesn't cover that. It's the silliest thing. So every time I hear a congressman talking about vision and dental, I'm over here saying, well, let's cover a physical. Let's cover a routine physical.
Fair enough. Yeah, thank you.
You're welcome.
Let's turn now to Representative Garcia. This is a question that, according to Governor Polis, if this passes, I assume this is the BBB that he's alluding to, we're talking 20 to 30% increases in premiums for most Coloradans, adding that number was based on the cost of uncompensated care for the hundreds of thousands of people who'd lose coverage entirely. Just parenthetically, the estimates nationwide are somewhere between 9 and 18 million people would lose their health care coverage. You can get different estimates. So, what impacts to the budget could the Finance Committee be looking at if this bill does in fact pass in its current form?
Good evening, everyone. I just want to say thank you all for being here and for taking an interest on what is happening. I know that these times right now are not only with this big, stupid bill, as Liz calls it, which is very accurate. Not only that, but it's also just everything else that's happening under this administration. And the fact that you all were willing to come on out and sit here and engage in a conversation like this shows a lot of your resilience. So thank you all for being here. As I answer this question, I need to share some considerations. The first consideration is that we have the country's most stringent fiscal policy called TABOR. Tabor is harmful to Colorado. It is harmful to every single one of us. The other considerations are within this bill, the bill that's currently waiting in the Senate. The other cuts that are being contemplated that also compound health include SNAP, include school meals, include protections, environmental protections that increase poor quality of air and water. We also need to consider that this year alone, we had to cut $1.2 billion from Colorado's budget, just this year alone. And we already, outside of BBB or BS bill. That's exactly right. I'm trying to see it. I'm trying to act as if my mom's watching. Outside of that, we are expecting more cuts next year to Colorado's budget because of Tabor. The other consideration as I answer this question is also that we have a lot more people who are your state reps and senators that hold corporate interests than they do people interests. And that's on both sides of the aisle. Mm-hmm. This past year, I brought a bill that could have saved Colorado or allowed Colorado additional spending room of over $150 million, but Democrats killed it because what it would have done is it would have eliminated a tax credit for regional home office for insurance brokers. What that means is that there is a tax credit that is completely and totally ineffective, a tax credit that was intended to pay or intended to incentivize insurance brokers in having at least 2% of their workforce here in Colorado. And since that tax credit came to be, we've lost 44,000 jobs that could have been regional offices here. So to me, that says we are paying insurance companies to take jobs out of Colorado. But no, Democrats were unwilling to support that bill. We could have also opened up by modernizing our software download credit an additional $100 million. That would have meant that if we had gotten rid of the software download credit, each of us would have ended up paying a penny on any time we downloaded software that we had to buy. A penny. But oh no, no. That's not worth saving healthy school meals, for example. So that died. Why is it important that I'm sharing this? Is because I want everyone in this room and everyone who's listening to understand that what we are facing at the federal level is not the only battles that we have when it comes to making sure that we are taking care of the people in this state and in this country. Because of all those considerations, if this bill passes in its current form, we are in a crap ton of trouble. Because not only are we going to have to figure out how to backfill Medicaid, we're going to have to figure out how to backfill SNAP. We're going to have to figure out how to make sure kids in school still get fed. We're going to have to figure out how do we still support enforcement of environmental protections, transportation, housing. All of this, as you all know, lead to health outcomes. So what will we be facing? Well, if this bill passes, I guarantee you we will be back in legislative session before January. What are our options? We could cut across the board. We could cut other programs. We could reduce eligibility even further than what the federal government is doing. Or we could send a question to the ballot to raise money. We could send a question to the ballot that says, hey, Colorado, we are close to the 9th richest state in this country, and it's about time we act like it, and it's about time that we make sure the wealthy pay their fair share in Colorado, and it's about time that we don't let corporate interests profit off of the pain and suffering of families. We will continue to be in this position because Tabor exists. We will not be able to effectively invest. We will not be able to effectively budget. Your state legislature is not allowed to set tax rates to make sure that investments happen or that tax rates are fair. We're not allowed to do that. So we are stuck. We are stuck with a formula that has nothing to do with the realities of the needs in this state. And there's nothing we can do about it until we generate enough support in Colorado to change or get rid of Tabor so we can actually be a responsible state. I want to be a state rep in a responsible state. It sucks being a state rep in a state where I have to vote for an irresponsible budget. It sucks thinking that we are going to have to be back in that building and picking between who eats, who lives, who breathes, who sleeps indoors. And I wish I could paint a better picture. But I will not lie to you. I will not say everything will be okay, because I need every single one of you to be as alarmed and as angry as I am. We don't actually need to be scared, though. Because if we work together, and if we are advocating both at the federal level and at the state level, and we tell our representatives and senators to kick their corporate interests aside, we just might be able to save Colorado.
Thank you.
And while we're at it, if we're going to start making changes to Medicare, let's start making some positive ones. Let's get rid of these stupid penalties. Yes. If somebody if they turn 65 and they have their Medicare A and B, and they don't have a prescription drug plan, Medicare gives you 63 days to pick one up. And then they start assessing a penalty of 1% per month for every uncovered month. So if you were uncovered for 12 months, you would pay an additional 12%, and that's based on the national average cost of a prescription drug plan, which this year is like $36 and change. If you don't take Part B when you're first eligible at 65, and you don't have another source of insurance that's from an employer that has greater than 20 employees, you get assessed an additional 10% every month on top of that $185 that is coming out of your Social Security check. And that $185 was $174.70 last year. Who knows what it's going to be for 2026. but these penalties follow my clients for the rest of their lives. And I think it's absolutely ridiculous that we punish people for not understanding the really complicated rules of Medicare.
I'm going to add to that. I think open enrollment time period is absolutely stupid.
It's barbaric.
Okay,
Yeah.
hear me out. November 1st to January 15th. What are most of you doing? There are like 29 holidays. Your kids have Thanksgiving break, Christmas break, all the freaking breaks, and then it snows and you have to like catch up on all the doctor's appointments. And how many of you had your teenage kids, wisdom teeth out during the day after Thanksgiving, right? Yeah, that's a good idea. So then on top of that, you're supposed to think, oh shit, I need insurance. That is the most asinine thing in the world. And when we had COVID and we had extended open enrollment, you know what? People signed up. I still have them as clients. They didn't say, oh, you know what? I'm going to have open heart surgery and then drop my insurance. Nobody did that.
Yeah.
Not a single case did that. And, you know, how is it that we're in like 2025 and we set up legislation that if you're pregnant, you can get insurance? Duh. Why wasn't that a thing before? Right? Why do we have to change our state constitution to allow women reproductive rights to an abortion? And abortions and spontaneous abortions happen in areas that have been poisoned for profit. So you get to poison me for profit and then deny me health care. So I bleed out and die.
Merry Christmas.
Here's the other, Merry freaking Christmas. Happy Hanukkah. And here's the other thing that really boils me.
Hey,
and
Liz.
another thing. And hold on I gotta say this because y'all need to like follow through on this. You have a right to pay and not pay certain things when you're getting screwed over. Ambulance companies navigated their way out of no surprise billing. So you may have an ACA policy, but you're screwed if you live in a rural area. I was $100,000 in medical debt, and here comes the ambulance company. Oh, you owe us $2,500. No, I don't. Senator Exum passed a law saying that medical debt is not going to show. You navigated your way out of payment, not me. So the Democrats came together this year and had a really great bill, and guess who frickin' vetoed it? Our governor vetoed the ambulance bill. So if you have ACA insurance, if you have insurance, and that ambulance company comes to you and says, can I have some money? No, absolutely not. Do not pay them. They navigated their way out of a payment system, not you. You got covered. Who cares? That's my philosophy. Anyways, I think that's my last rant.
Okay. Well, thank you very much for your rant and your expertise. I'd like to put the mic back on the stand here and give anybody who has an additional question or comment the chance to make that. And then very shortly we'll be finishing up for the evening. So please take advantage of this moment if you want to.
Liz, you opened the door a little bit earlier. I'm going to walk.
You got to get closer to the
Oh,
mic.
you want to make it closer? Is that better? Okay, Liz, you opened the door, and I'm going to walk through it. Who owns Memorial Hospital? Who owns it? You do. Yes. UCH was only hired to manage it. You still own it. And I've talked to a couple of council members. Why isn't the city building a hospital in the southeast part of town?
It's BIPOC, Black, Indigenous people of color. They have the most babies, so of course they're not ever going to build a hospital there.
Of course.
I say the quiet parts out loud. Too many black people, brown people, they don't care.
Okay, but we can control the city council. The second thing is, you're under two Tabors here in Colorado Springs, not one. Okay?
So that's the extent of it. The only thing I can say is we have to get the hedge funds and the private equity firms out of the medical businesses.
I'm Steve Waldman. I'm in charge of communications for the 5th Congressional District of the Democratic Party. And Jeff Crank has said, and let me quote him, that illegal aliens can get Medicaid benefits for 89 days before they have to provide proof of citizenship, and that those illegals are stealing $3 billion a year from Colorado taxpayers. Is that true? And if it is not, how do we counter his message?
First of all, I want to just point out that the only illegals right now are ICE, who are illegally kidnapping and disappearing people. The 89 days that he is talking about only exist for people who are waiting for eligibility to be processed. There is a period of time where you can start getting coverage on Medicaid here in Colorado while they investigate your eligibility, like your income eligibility and your address and all of that. One of the things to note is in Colorado, we have an incredible, incredible program called Omni Salud, which is open to folks who aren't eligible for folks to qualify under the federal program. So we have made that a legal program for Coloradans, and Jeff Crank is an idiot to think that that's not lawful.
Thank you.
Hello. I want to thank you all for your time today. Thanks for coming out. My name is Kenneth Smith. I'm a local medical student and a medical worker here in Colorado Springs. Thank you. I have a couple of questions, actually, but I'll keep it as brief and simple as I can. Ms. Liz, you did bring up the donut hole, and
Yes.
I think that was a great point. I haven't heard anybody mention that at all today, and that's actually the key to my question. And if you want, you could take time to explain what that is to anyone who doesn't know. But my question is, how do we close that gap in the donut hole? And how do we get more people that coverage that they need? For example, I work in healthcare, and a lot of the people I work with, they work in healthcare also, but they can't afford healthcare. I have a friend who is on Medicaid, and at work, like the past week, she's been like stressing, like, hey, I can't take my pills. I can't, go to work. I have several like migraines, and I have all these other issues, epilepsy and things. But she's just struggling, and and it's all because of the healthcare. She's like, I can't get the treatment that I need. So my question is, what can we do to keep healthy people healthy? How do we get our healthcare workers, like if we are working healthcare, how can we provide healthcare if we're not receiving healthcare? And what do we do to kind of mitigate this problem from happening further in the future?
So the donut hole was sunsetted at the end of 2024. It was this ridiculous way of Medicare would cover your prescription drugs last year until the total amount of your drug costs hit the $5,030 mark. So that was your $45 copay plus what the insurance company kicked in, added together. If during the course of the calendar year, your drug costs hit $5,030, instead of paying $47 for your Eliquis, now you're in the donut hole and you're paying 25% for that Eliquis, which is hundreds and hundreds and hundreds of dollars. To get out of the donut hole, you had to have $8,000 in total spend. So what would happen for the majority of my clients is they would hit the donut hole in October, November, and there's just not enough time on the calendar to get to the $8,000 mark. So that was sunsetted, and it was replaced with a new system. So now nobody on a Medicare prescription drug plan in America will have more than $2,000 in out-of-pocket costs per year. So my client in Woodland Park that has a $17,000 a month prescription drug, he knows he's going to be out of pocket $2,000. But that's Joe Biden. Yes, thank you, President Biden. That is 100% President Biden. Unfortunately, the drug companies and the insurance companies actually have to absorb more of the prescription costs for Part D programs. But what they've done now is they've front-loaded those costs in the form of a deductible on the higher tier medications. So your first fill of the year is your ouch fill, and then your drugs will continue to get lower and lower as the year goes. I've never quite figured out how the math works because it doesn't make sense, but the good news is that it does give seniors or anybody, because you don't have to be a senior to be on Medicare. If you're disabled under the age of 65, you qualify for Medicare as well. But it gives people on Medicare prescription drug plans, now there's an opportunity to spread that $2,000 cost out over the course of the year. It's called the M3P program. So let's say you're on an Eliquis or inhalers, common drugs that lots and lots of my clients take. They could take that $2,000 and divide it by 12, which would bring the cost of all of your medications down to about $168 a month, which, for me would suck to have to spend that much. But I'm telling you what, for my clients that are making $1,400 a month, even to have to pay $168 a month to cover their prescription drug costs is absolutely ridiculous. When I was traveling internationally last year, that adage about it's like riding a bike. Well, no, I managed to fall off a bike in Vietnam and get tons of road rash. Walked into a pharmacy and using Google Translate, showed the nice lady I was worried about infection, and for $2 sold me a box of Augmentin, which was the perfect kind of antibiotic for that kind of wound. I don't understand why we can't have that in America. So, and who knows what next year's going to look like? That's the great unknown, and those are the questions I get every year. And I have to tell people I don't have a crystal ball, but hopefully 2026, I don't anticipate 2026 to be a rough year for Medicare recipients. The funding has increased. So I think we're going to see some of the Advantage plans look a little bit better, but God help us for 2027 and beyond, because who knows what that's going to look like.
I agree.
Well, and that's a very good point that we haven't really said out loud tonight, and that is that these proposed changes are set to go into effect in December of 2026. The elections occur in November of 2026. So any sense of accountability or the pain... Yeah, what a coincidence. So bear that in mind, and it's also sort of patently obvious how that's set up.
And 2 years ago, if somebody asked me if there were going to be cuts to Medicare, I would give that standard, it's the third rail of politics answer. And I truly believe that in my heart of hearts. And I majored in political science. And now when people ask me if there are going to be cuts to Medicare, I say, you know what, who would have ever thought we'd lose Roe versus Wade, or we'd lose Roe? So you know what, I'm not taking anything for granted, and I don't think any of us should. So if they hear from enough of us, this is a big voting block. Seniors vote more consistently than any other demographic. But we have to do it, and we have to stay in front of our local and our national representatives and let them hear from us.
My name's Ultra. I happen to be the CD5 district chair for the Democratic Party, so thank you all for coming tonight. We're trying to work on getting Crank out. But my question is, my day job is personal injury. So those of you who don't know, car accidents, if you go to the ER and you have no insurance, you can ask at the ER if you are eligible for Medicaid, and you have 30-day back to get that implemented. So we see that a lot in my day job, where we've got young people, especially anybody who's between 26 and 35. Do you guys have any thoughts on how that catastrophic coverage, because that's the other thing too, is when you're in that 26 to, I believe it's 35 is still the cutoff, you can pay very little for what they call catastrophic care. And basically that just means if you're in a car accident, if you have some major thing, you only get covered for that. It doesn't cover primary care and basic stuff, but it's catastrophic coverage. How is this gonna make that work or not work worse than it already does?
Right, so catastrophic care is if you're younger, right? But that deductible is $9,000. You're still gonna have to finance $9,000 of medical bills. It is not a solution at all, ever. What I want you to be super aware of are health shares or scams. If you are reading a policy that you think is health insurance and it's showing up as United Healthcare, and they also offer you a car rental discount, and it's 500 pages long, only read the fine print. You're getting scammed. They call it private insurance, and it's not regulated by the state of Colorado. They've tried, but it's not insurance, it's a health share. And they 100% deny you on everything being pre-existing. I had a young man break his thumb. He signed it up for a health share scam. They took $1,200 from him and did not pay for his surgery. So he called me on the phone and he's like, I lost my job because I had to have surgery on my hand because I had a very physical job. What do I do? And I said, you go on Medicaid and they're gonna pay for your surgery. And then you're gonna get out of your situational poverty. And here's the link. And here's how you report that scam. And then I've reported that scam. So please make your friends aware that if you're reading a health insurance summary, it clearly lays out that it is ACA. You have a copay, you have a deductible, you have a max out of pocket, and it says pre-existing doesn't matter. In the fine print, if it says this is not ACA, run like hell. You will be scammed and you cannot get your money back because it is not regulated, because it is not insurance. And young people are scammed the most in in emergency rooms out of that. They find out the hard way.
Great advice. Thank you all so much. We really appreciate all of our panelists and all of our audience involvement. Oh, sorry, you have one more thing?
So you bringing up the scam made me remember that during the open enrollment period, I got a phone call, multiple phone calls from a insurance place that was called like U.S. Insurance. And they're like, we give insurance to first responders like firemen and police, and now there was a recent law passed that says that they can now give it to medical staff. So as a CNA, here's the insurance. And I'm like, well, let me check on this and see if it's legit. Unfortunately, their name was so generic that I'd be like, U.S. Insurance. They'd be like, here's how insurance works in the United States of America. And I'm like, I'm looking for a specific company. So do you know anything about that? Is that a scam or is that legit?
You did a good job of questioning it, looking for ACA. It is a scam. Good job.
Oh, thank you.
Thank you. Kenneth Smith again. I just got one last question. I did appreciate your insight on the Medicaid and Medicare question. My next question is VA. I am also a disabled veteran here in the Colorado Springs area, and I know a lot of other people here are as well. How would these cuts to Medicaid, Medicare, and all this other general insurance, how does that affect VA care? How does that affect, in general?
Oh,
like, how does that work?
Yeah, so there's a gray area that I like to play in with Connect for Health. If you are 100% disabled, you cannot get a tax credit. But if you are maybe like 30% for your ankle and your DD 214 or whatever the paperwork says that your insurance or your VA only applies to care for your ankle, then you can get like a tax credit somewhere else. But if you're 100%, you're just really out of luck. And I've had a few brave people try to fight that system right now to say, yeah, I'm in, El Paso County, but if I have a mental crisis or I'm injured, I can't get an appointment tomorrow at the VA. So that's a fight that we can do and hopefully get some results.
However, the VA is also under some degree of threat right now.
It is.
Yeah.
They closed out Saturdays and they cut down their hours, and y'all have off on a random Wednesday from your job to go to the doctor. Like, if they're going to cut hours, cut them in the morning and be open in the evening. That's when y'all have time.
Fair point.
If I can just add a little bit of clarification there, the credit that Liz is talking about is a Colorado-specific credit.
Yeah, that's just
as I understand, and I might understand your question a little differently, across the board, the federal government, Trump has been slashing as much as they can. DOJ has been slashing as much as they can. They've been eliminating resources by firing people. And so the way in which the VA has been significantly impacted is through the elimination of staff. And so in that, while there hasn't been a direct cut yet to VA services, whatever funds that exist there cannot actually be utilized for vets because the staff isn't there to actually serve vets. And so that's where you're feeling those cuts. I just fully admit I don't know if there actually is VA cuts in the BS bill. I don't know if anyone else here knows that. Okay, could you share what those are?
Joe Reagan, you want to come to the microphone because you work at Mount Carmel and veteran.
Well, I'm going to speak as a candidate here. This is not representative of the work that I do in the nonprofit space. Okay. But yes, the HR 1 does in fact put a lot of pressure on the VA system. The goal there is to privatize it. So the goal through some of these cuts with staff reductions is to make life so miserable at the VA that you seek private care. Mm-hmm. That is exactly what the goal is, and that is exactly what is happening. And you will see that. And we talk about cuts to 988. We talk about mental health care cuts. All that stuff is happening here. And I'm very grateful for the support that we've received this year from the legislature to make sure that programs like Next Chapter here in El Paso County have continued. So this was, the legislature passed allowing the revenues from KK, this is the ammunition and gun tax, that money is now going to support mental health care programs here in not only El Paso County, but across the state. So there are things that are happening at the state level to help compensate for that. But yes, the VA 100% is seeing cuts across the board, mostly in the staffing side.
So we've had a very productive evening, I think. I'm sure there are still many areas to talk about, a lot of things we could say. I think it's time to hold that in abeyance, either for after or for another opportunity. But thank you so much. I want to say one other thing. Please check in on your way out so we can get you more information. Please look at the form for further action. This is like throwing a rock into a pond. We're this pond. But if we now ripple this out from all of the people that we know and extend our discussions, the power of this will be magnified, and I would encourage you to do that. Thank you for your interest, and we look forward to seeing you at our next event.